Next, we have Catherine Bussey from PA.
Hello, Health Secretary. I wanted to ask about Test and Protect, which of course got up and running on Thursday of last week. And I was wondering if there were figures available as yet for how many contact tracers have been involved in efforts to stop the spread of COVID-19 and how many people they have been in contact with to say that they could be at risk, that they may have been in contact with an infected person.
Thanks very much, Catherine. I don't have the exact numbers there that you're asking for, and of course I'd want to be sure that they were absolutely accurate before I gave them to you. Test and Protect began on Thursday, was stood up, if you like, on Thursday, with that 2002, I think, were the number of contact tracers we had ready to be deployed on Thursday, but the numbers of contact tracers who've been used and the number of contacts that they have worked on in the 3 days or so since then, I don't have those numbers. We have made a commitment to publish that information on a regular basis, but if we do have that as of today, then we will make sure that you have that this afternoon. Other than that, on the whole operation of Test and Protect, which of course is absolutely vital to us being able to ease any of the lockdown measures. I don't know if Jason wants to say a bit more on that.
Only that I have heard no problems around the country. I know that contact tracing is up and running. I was involved personally in an individual case, which I won't describe because it's an individual case, about care moving between health boards quite routinely, in fact, across Scotland's National Health Service, like we always do. And there was a contact tracing element of that case, and it was being handled perfectly well by contact tracers and health protection teams. So it gave me some reassurance that that system was working. And I haven't heard any intelligence to suggest to me that there are teething problems. I actually anticipate that it will not be perfect from day one. You would expect a system that we are ramping up at this scale to perhaps give us some intelligence that we might have to go in and have a little look, but I've heard nothing in the last 3 days to suggest that anything is wrong with our Test and Protect system. It also gives us the opportunity, of course, to say that Test and Protect relies on individual behaviour, not just on the National Health Service doing its bit. It relies very heavily on the individuals who get tested and on those who are contacted by the tracers to follow their instructions.
Two other things I would say just before we leave this is that when we stood up Test and Protect on Thursday, not only did we have those 2002 contact tracers identified, every single board in Scotland had its teams ready, and all our public health partnerships, who are the groups that will provide support for those who need it, who are asked to isolate, were also ready. So our system, both at a national level and locally, was ready at the point when we stood it up, as we needed it to be, to back up the easing of the lockdown measures that the First Minister announced. The other thing I would say is that we are in constant contact with those teams in order to identify where there are teething issues that might need to be addressed, and that will continue all the way through as the system beds in and we make sure that everything is working as it needs to work.